Great. So my name is Michael Greenberg. I'm a parent of a young adult with autism who's served by a wonderful service provider in Montgomery County. So I speak really as a physician, but firsthand kind of with a young adult and with a pretty good understanding of service providers and everything they do. And so I first want to thank each and every one of you on this call for what you guys do. I've seen hundreds of DSPs and their service providers through this pandemic, and each and every one of you have truly earned my greatest respect. So thank you all. So what I want to try to do today is to provide as much information as I can about the current vaccine and answer as many questions as I can. Whatever we can't get to, I will answer by email, separate from this. I've broken the talk up into a couple of different categories. I'm going to ask people so that it's a little more interactive. I'm going to ask people to try to type in the chat box questions that they have relevant to the section I'm doing. And then in between each section, I'll try to answer a couple of those just to break it up. And then at the end, I'll open up for all questions. So with that, I'm going to try to cover today in the first section just some kind of highlights of key information about the vaccine. So if you ask me, I only have 3 minutes or 5 minutes, what do I need to know? I'm going to try to get it in there, get rid of some of the misperceptions, try to understand some of the barriers to the vaccination. Then I'm going to go through what vaccines are there out there, how the vaccine works, how is it being rolled out in Maryland, and
I think.
then I'm going to try to talk about the vaccine safety, efficacy, which means does it work or how well, and the side effects, and then some considerations, should I get the vaccine, and answer questions. So that's going to be kind of the format. If we start off with kind of some general information and highlights, really important to recognize there's a lot of misinformation out there in the media. People hear about something that happens, it goes to a reporter, it gets into a tabloid or on the news. A lot of the information that you hear straight up out in the media is frequently wrong. And I'm talking about the stories, I can't take it because I'm pregnant, I'm going to become infertile. Somebody has a heart attack after it. Really stop and pause and really try not to form an opinion based upon what you see in the headlines. There are many, many good sources of information, and just think critically about what you hear, because more often than not, it's wrong. I want to point out, when most people think about the vaccine, what they're really concerned about is, is something bad going to happen if I take it? Not am I going to have a runny nose, but is something really bad? So everything that we do as direct support professionals, as teachers, as parents, has risk with it. And I don't know if you know where I'm going with this slide, but if you look in Montgomery County, your chance of being shot in the next year is about 1 in 10,000. That's in Montgomery County. If you look at your chance of being in a fatal car crash, it's about 1 in 12,000. In your lifetime, you've got a 1 in 15,000 chance of being struck by lightning. If you talk about the vaccine, in over 5 million doses that we've used in the United States, no deaths from the vaccine. In terms of like serious allergic reactions, no deaths. About 1 in 100,000 people will have some type of significant severe allergic reaction. They've all been treated and gone home. So it's really important to put things in perspective. Nothing we do is completely safe, but getting the vaccine, if you want to think about it in safer terms, in simpler terms, you're safer doing that than most things that you do every day. Just some common misperceptions that have been out there from what I've seen in the media from talking to people. Can I get infected with COVID if I get the vaccine? And that's a really good question. That's a question a lot of people have. The answer is absolutely not. It is not possible to get infected with COVID from the vaccine. There is no living virus in the vaccine. There's not even any dead virus in the vaccine. It's a man-made chemical substance that stimulates your body, but it's not possible to get infected from getting the vaccine. A lot of people are concerned because they hear stuff about allergies and, you know, if I have peanut allergies, if I have latex allergies, if I am allergic to pollen, if I carry around an EpiPen because last time I had shellfish, I needed it, does that mean I can't get the vaccine? If I'm allergic to penicillin, absolutely not. There's no cross reactivity between the substances that you are allergic to and what's in the vaccine. So for all the types of things that people are typically allergic to, um, there's no relationship between that and the vaccine. So the CDC, all the allergy groups, they all say get the vaccine. A lot of people, again, are, is it dangerous? Is something really bad going to happen? The answer is no. Does it have side effects? Some side effects, like all vaccines and medications. But I think, as I kind of showed you before, the risks with the vaccine are really very, very low. You've got a 10 times greater chance of being shot in Montgomery County than you do, of having even just an allergic reaction, a serious one to the vaccine. So the real answer is the vaccine is not dangerous. Um, there was a lot of media publicity, and it sometimes I've heard this more in different groups of DSPs and others. I work in the VA hospital. I've got a lot of staff and patients from all over the world, very diverse population. So there was a question about whether it can make you infertile. That somehow made it into the media, and a lot of people were concerned about that. Absolutely not. No relationship.
Dr. Greenberg, can I ask two quick questions that are in the chat?
Yes.
So there's one question saying, what about the Florida doctor that died after receiving the vaccine? Have you heard
Sure.
about that?
Yeah, absolutely. And that's actually was one of the pictures I put up there. So the Florida doctor that died after the vaccine, let me try to say this slowly and put it in perspective. We've given it to over 5 million people in the United States. Okay. So 2 weeks after you do anything, or 2 weeks after somebody eats a meal, if you have 5 million people eat dinner, 2 weeks after that, things are going to happen to those people. But it doesn't mean it's related to the fact that they had dinner 2 weeks ago. Okay. So there is nothing to suggest that the death of that physician was related to the vaccine. When you look at 5 million people, you're going to find things that happen. You look at 5 million people, somebody may win the lottery. That doesn't mean it's because of something else. So that's what gets into the media a lot. So that person developed like an immune problem. And then there was another physician who had a heart attack 2 weeks after getting the vaccine. But there's no relationship at all between those two things.
Thank you. I have one more question.
Yeah.
I heard that you can be asymptomatic. You can be an asymptomatic carrier after getting the vaccine. Is this true?
So I'll answer that in more detail later. But what's important to keep in mind, and that is true, we have to separate what the vaccine does. And this is very important for everyone to understand. What the vaccine does is it keeps you from getting sick with COVID. COVID is an infection. That means that you get sick with it. It doesn't mean that you can't carry it around and give it to somebody. So it protects you. You get that vaccine, you're not going to get COVID. It doesn't necessarily mean it protects anyone else. So the answer is we don't know for sure. We know it keeps you safe. But yes, if you get the vaccine, you still have to wear your mask. You could still pass it on to your parents or your clients. it means that you are not going to get sick with it. There are people that get the vaccine and probably never even have the virus in them. The people that get the vaccine and may still have virus that they contact, but they just don't get sick. So the vaccine prevents you from getting sick or getting the infection. So the simple answer is you could still pass it on and be an asymptomatic carrier.
Okay, thank you. One more question, then you can continue.
Yep.
Why do some vaccines require boosters?
So the reason vaccines require boosters is because when you give a vaccine, and this is true for all vaccines, you're teaching the body to make antibodies that can destroy the virus. So when you give somebody the first dose of the vaccine, their body says, oh, okay, I know what I got to do now. And it prepares itself and it makes a good amount of antibodies to destroy the COVID virus if it ever needs to. But it needs to see that second dose to really ramp up and make all the antibodies. So it's a way of ensuring that you have complete or near complete protection. So you're basically giving the body two chances to produce what it needs to. Okay. So what are the best reasons, what are the best reasons to get the vaccine? So the first is it's going to keep you from getting sick with COVID. Okay. You will not get COVID infection. It will keep you out of the hospital. Even the very small number of people who get the vaccine where they may get the actual COVID infection, they don't need to be in the hospital generally. And it'll keep you alive. People that have been vaccinated with COVID, even the small ones, small percentage that it didn't work in, meaning they got COVID, it was mild, none of them died. It keeps you alive. It keeps you out of the hospital. It keeps you from getting the COVID infection. The other big reason is, as many of you have heard, there are these new mutant strains of the virus floating around. We know that the vaccine that we have now from Pfizer and Moderna probably works against the new strains. The new strains are not more dangerous, they're just profoundly more infectious. I mean, you think of how quickly this virus is spreading now. Imagine taking that and multiplying it by 50 or 70%. So a real good reason for getting the vaccine and getting it now, not tomorrow, not the next day, is that it's getting more dangerous out there because this new virus variant is spreading. So the vaccines that we have now that you are eligible to get are effective as of today, as far as we know. So what can you expect when you get the vaccine? So on the bottom is me, okay, getting it at the VA hospital in Washington, D.C. I would have been number one on the list if I could have, but I couldn't. On your right is probably, I think it's your right. That's our director of cardiothoracic surgery. And on the left is one of the 100 staff that I work with getting it. This is exactly what you can expect, okay? And I don't know for those of you who can see, but that was my second Band-Aid for my second dose. I wanted a lollipop and a smiley face, but they wouldn't give it to me. You will feel a small pinch from the needle, just like with any other, injection, okay? Your arm will probably feel a little bit sore. Usually the next day, you get a little soreness in the arm. They will watch you after you get the vaccine injection for 15 minutes. That's because we do that because we know if you're going to have a bad allergic reaction, and again, remember, only 11 people in a million have a serious allergic reaction. If it's going to happen, it's going to happen then. So they watch you for 15 minutes and they have everything there to treat you. Anybody who's had an allergic reaction from the vaccine, the rare people that have, they've all been treated, basically gone home. And then they'll give you an appointment for your next dose. That's exactly what you can expect. Now, some people, and it's usually people that are kind of I'll say younger, but it's really kind of younger and healthier. So a 30-year-old direct support professional, 40-year-old direct support professional, a young teacher, um, you have very healthy immune responses. So it is normal, and it's actually a good thing. Some of those people will get the next day will get chills, a little bit of muscle aches, a low grade fever, some headaches, some tiredness, just kind of like you feel like you have kind of like the cold, bad cold. That lasts for 24 hours and then it goes away. That's actually a good sign. What that means is that your body it's working. Your body's producing antibodies and building up what it needs to. That's a little more common after the second dose of the vaccine than the first. And in many people, it doesn't happen. The majority of people probably do not get this, but some people do, and that's totally fine if they do. So one of the big things that we really need to be aware of is we were able to create this vaccine, which is huge, but it only works if people get it. And in order for all of us to be safe, for kids to go back to school, for parents to hug their children, for direct support professionals to finally eventually be able to take off all the gear they're wearing, we have to get people to take the vaccine. So part of my, you know, passion in doing this is to try to give everybody the education they can to feel comfortable getting it. A lot of the polls that have been done, each one of these different colors is kind of a poll that has been done, and many of them, almost all of them, they show that up to half the population has very strong concerns about taking it because they're just afraid. Um, and if you break it down further, there's a much stronger level of concern and initial unwillingness to take it amongst, and I've only put in kind of a couple of what we would say, if you want to use the word minority groups or whatever term you want to use, but up to 20, up to a large, whatever minority group you want to look at, very significant percentages will not get it. Okay, so they're concerned. So a lot of this is education and trying to give people the information they need to go ahead and feel comfortable getting the vaccine. Um,
Dr. Greenberg, do you want to go ahead and answer a couple questions?
yep.
Okay. Okay. What if you've already had COVID? Should you get the vaccine?
Yes, if you've had COVID, get the vaccine. Having COVID protects you probably for about 90 days. After that, we don't know. So the CDC recommends that if you've had COVID, but it's been 90 days or more, you want to get it.
Perfect. Thank you. Another question. Will a person who gets vaccinated always have a positive COVID result?
Um, it, I have to it depends what you mean by positive COVID result. So when you get a COVID test, there are two types of tests. One is where they would swab your nose and look to see if they see the virus in there. The answer is no, not necessarily at all. The other is where they test and see if you made antibodies. So your body would show that it's protected. So, but you would, when we say a positive COVID test, like if you think about going and getting tested for COVID, the answer is no, you would not always have a positive COVID test.
Thank you. A couple more. What does post-COVID or long COVID mean?
Post-COVID or long COVID is kind of a very generic term. It's not so much a scientific term, but what it may be referring to is there are people there are two ways it can be used. There are people that have COVID, the illness, that then have problems down months after. So we think of COVID as kind of you get sick, you go into the hospital, and many people die. But there are people that get sick, may not go into the hospital or go into the hospital, make it out, but then for weeks, months, maybe even years, have other types of problems, heart problems, all sorts of delayed problems from the COVID virus. So that's another reason to also get the vaccine. It doesn't just prevent you from getting sick in the way we think about, oh, my friend got COVID and he was hospitalized. I see them at the hospital all the time. I'm a cardiologist. We have dozens of patients who had COVID, maybe not even really bad, but then, months later they have problems with their heart. So that may be what long COVID is being referred to.
Thank you. We're going to answer a few more because a bunch came in at once. There has been some information going around that there are pork products in at least one of the vaccines. Can you touch on this? I know that some flu shot manufacturers use egg products. Is this sort of the same thing?
So to the to the best of my knowledge, that is not there is no issue with any of the approved vaccines. I'm not talking about unapproved, but the Pfizer and Moderna, there are no issues. There was media coverage several months ago that kind of hyped certain things, and it wasn't a problem with the virus. It wasn't a problem with the vaccine ingredients. It was a problem with the logistics of the way stuff was being the supplies are not getting the factories. But there is no problem with any of the ingredients that I'm aware of at all. Doesn't mean there's not a news story, but there's absolutely no problem.
Thank you. Another question. Can you get the vaccine immediately after recovery from COVID?
So good question. The general answer is because there's a limited supply of vaccine, and because we do think that having COVID protects you for several months, the CDC generally recommends, and most vaccine centers won't give it to you if you've just had COVID. They'll give it to you 3 months after.
Thank you. Dr. Greenberg, there's a couple more, but if you want to continue on with
Okay. Sure, and then we can add
your
them in.
yeah,
So,
presentation.
so really important as, and this came up before, the vaccine prevents you from getting sick. It does not prevent other people. So if you're, to make it real, if you're a direct support professional and you work in a residence or you work in a day program, for now, you still need to wear your face shield because you're not going to get sick, but you could have the virus floating around in you, not even know it, and give it to someone else. So you still have to take precautions, but the precautions are a little bit more to keep other people safe. So I just want to kind of make sure people understand that difference. Um, okay, I want to go into now what vaccines are there, what's out there. So we're going to focus on there are two FDA approved vaccines, the Pfizer and the Moderna. There are a whole bunch of other ones, but the only ones I'm talking about are the ones that are right now approved. The AstraZeneca will probably be approved shortly. It's being used in England. The Pfizer and Moderna vaccine were approved in early December, December 11th, December 18th. They're both effectively the same type of vaccine. From a person getting it, doesn't matter which of these two you get. Whatever I say about one completely applies to the other. That's not true with some of the other vaccines coming out, but these two are the same. The only difference is the Pfizer needs to be kept stored really cold. But in terms of how they work and everything else, side effects, they're identical. I want to give you the information so you can understand firsthand, not just say it's safe. The Pfizer vaccine, which is the one that first came out, is what's called a messenger RNA vaccine. If you take away the science, what it means is there's no living virus, there's no dead virus in it. They looked at it in 40,000 people who they studied intensely. Those people were all over the age of 16, which is why we don't give the vaccine to younger people because we haven't proven yet it's safe. We're studying that, but you get 2 doses of the vaccine, 1 dose on day one, and the other one is about 3 weeks later. So it's separated by 3 weeks. And again, to the question before, it gives your body a chance to really build up antibodies to protect itself. It's 95% effective in the studies, okay? Which means that in 95 of 100 people that get it, it works. That is huge. If you compare that to other vaccines like the influenza vaccine, we struggle with, 70%, 60%. We were hoping when this was first developed, we would have been happy with 70%. It's actually 95%. And that is really, really a very effective vaccine. So one of the questions is, were people like me in the study? Okay, I mean, who was studied? So in the Pfizer vaccine studies, there were about 43,000 individuals. They very wide age range, from 16 up to 91. They used about 150 plus different sites or places they studied throughout the world, not just something done in, in one part of the United States. There was a pretty even distribution between men and women, which is good. For many, many years, I mean, I've been doing this and been doing research and clinical studies for many years. And especially like 20 years ago, these studies would be like 90% men, and you'd be lucky if you had 10% women. So importantly, it was studied in both genders. There was, I don't wouldn't say I'd like to see more, but there was representation in, blacks, Hispanics, Asians, whites, and others. Um, Part of the limitations here is the ability to recruit people. If people are more nervous, they're not going to get it. But there was reasonable, representation. So it was used in many kind of different types of individuals. Um, Let me just quickly touch on the Moderna vaccine, because you may get either one. So I want you to just understand that they're really the same thing. Pretty much everything here is the same. This one, they looked at people 18 and older, not 16, but that's a very minor difference. It's also 2 doses. The only difference here is you get on day one, and the other one is 4 weeks apart, whereas the Pfizer was 3 weeks. The same effectiveness, 94%. So again, incredibly effective. All right, let me stop and take a couple of questions. Um,
Okay,
Anybody?
let
Yeah.
me see. Can I still donate blood after I get the vaccine?
That's a good question, and I don't know the answer to that. My guess would be yes, but I don't want to kind of give out wrong. So I don't know the answer to that.
Thank you. How long does the vaccine protect you?
Excellent question. We don't know right now at this point. Um, so I want to be careful. I only want to kind of give information about things we know for sure. So we know it works for, 3, 4 months, 5 months. It may work for a year or 2 years. We just don't know, because we haven't been able to follow that many people. So the best thing we can say is it works for 3, 4, 5 months. We will have a better idea over the next year or so, because we will be able to see all those people we gave it to. So I think the real answer is we don't know, but we're sure it's more than 3 months, and probably significantly longer.
Okay, another question. Is there any way to really determine if you already had it? If antibodies are only present for 90 days, I won't ever be able to tell if I had it last winter before COVID was a thing. I was sick for 3 months and my lungs are not the same.
Yeah, that's a kind of an individual question. So it's a little hard for me to answer that. I'm going to kind of buck that, because there's just too many specific things I need to kind of know. There are people, if you had COVID in general 6 months ago, you may not be able to test for it now and really know for sure what was back then. So that would be a general answer.
Got it. Thank you. One more question, or I think a couple of more questions. Given that it is a new vaccine, what are the concerns for any long term risk of the vaccine? Are there any?
Sure, that's a really good question. So the answer is, we only know for the amount of time we've been using it, 3, 4, 5 months, 6 months, 7 months, for depending on, we're talking about the studies. So in terms of long-term effects, we don't have that information. Um, we know from almost every other vaccine out there that the problems people get with vaccines tend to be now. They're not things that occur years later. That's just not what we see in any of the other vaccines, whether it's a polio vaccine or a measles vaccine, or or it's whatever vaccine you want to choose. So we don't have any reason to suspect that this would be any different. Um, I know there are very strong opinions and people have, there's a lot of, you know, strong coverage and concern with actually vaccines and stuff causing autism and, to put it simply, and everybody has opinions about that. But from a scientific standpoint, that information and the stuff that was published around that was fraudulent and it was retracted by the people that did it. So I don't want to kind of focus on that, but that would be a natural question somebody might raise, but there's no evidence we have at all, and nothing with any other vaccines.
Thank you. One more question. Is natural immunity better than acquired immunity?
Yeah, I think that's a hard question to answer. I don't think we could really say, having studied it, I don't think there's any real difference. If you're immune to it, you're immune to it, and you're being immune means you're not going to get sick a second time. The only way to have natural immunity would be to get COVID. So I don't think anybody, the risk getting COVID to get immune wouldn't, I don't think there's a difference. I think when you're immune, you're immune.
Okay, I'm going to ask one more question, then you can go back to your presentation. Once I get the vaccine, will it be necessary to get tested for COVID?
So in the short term, the answer is yes, because remember, you're getting tested for COVID probably not to see if you have it necessarily, but because in organizations and so forth, we have to make sure it's safe for you to work with other people, and that you're not going to give it to someone. So the answer is, in the short term, you'll probably still need surveillance testing within organizations and groups. And the other thing is, it's 95% effective. That's not 100%. So people need to, it's not like a magic bullet, like, okay, now I can go out and party, do whatever I want. There are people that can get it. 95% is not 100%. So yes, you will still need to get tested. If you've had the vaccine and you've developed signs or symptoms of COVID, then you'll want to get tested, and probably your organizations will still do surveillance testing, at least now. Down the line, that'll stop, but for now, yes.
Thank you. Yeah, I'll answer
Okay.
the next one in the next round. Okay.
I'm going to go through just very quickly how the vaccine works, just real quick, because I want to try to get. So the vaccine uses these little particles on the top. We take the information, the genetic information in the lab, and we're able to make something. It's not part of the virus. We make something, we put it in a little fat capsule, if you want to think about it, and then we inject that into you. There's nothing in here that is part of the vaccine. It's just basically instructions for your body. Your body now has the instructions, and what it does is your body will make some of these little kind of, we call them spikes. So this is just the same type of thing that the virus has. So this is what your body will see, and now it produces all the necessary protective antibodies. So if it ever encounters these things in real life, it can kill them. So that's how kind of the vaccine works. And it's different than it's different than other vaccines, which actually use parts of the virus. This does not. It simply takes this part of the virus. In the lab, we make the genetic information, we inject that into you, not the part of the virus, and then your body protects itself. So let me talk about now, when will the vaccine become available and how is it prioritized? Okay, so how is it going to get rolled out? So that is something that everybody kind of, when can I get the vaccine? When can my individual? When can my parents? So there are different phases. Some of this is local, depends on the county you're in. But in a simple sense, direct support professionals in general are in the highest categories, along with other healthcare providers, to have priority to get the vaccine. That is because they recognize that what you guys do is, it's the same thing that I do. I mean, you're an essential worker, you're taking care of people, you're in the highest category to get it. There is some variation depending upon the county you're in, but basically you're a high priority group. So take advantage of that. There are literally millions of people clawing to get this vaccine. You guys really have an open door in within a certain way to get it. So I strongly encourage you to take advantage of that. The actual rollout of the vaccine is very, very complicated. I'm not going to spend a lot of time. Some of your leadership and administrators need to be familiar with this, but there's the federal, state, and local level. Many of the individuals that you serve, if you're a direct support professional in the group homes, will be getting their vaccine through a federal partnership. Um, sorry, federal partnership that will have CVS and Walgreens come in and give it to you. And that would be both for the direct support staff as well as the individuals. There are other ways for the direct support staff to get it at the local county level, depending upon each county slightly different. So it's a very complicated rollout, and a big undertaking. But in and I'm just going to give you an example because there is variation in each county. In Montgomery County, there are four kind of ways you can get the vaccine. And remember, it's great to be in a high priority group, but it's only if you can get the shot that it makes a difference. So in Montgomery County, you can get it in hospitals, and that's mostly for like doctors and nurses. There are insurance companies where that'll be one mechanism, but the real kind of for our group, our population, the sorry, let me go back. The hold on. For our population, the biggest places that people are going to get it are either through the clinics or through CVS and Walgreens. So that's important to be aware of. Okay, that's going to be the primary mechanism. Individuals will probably get it through CVS and Walgreens, and clinics will be used to supplement, and direct support staff may be getting it there. All right, let me take a couple of questions.
Okay. I think only one more came in.
Okay.
How can it really be deemed safe given that the fact it was produced so quickly? Aren't trials supposed to, or aren't, what am I saying? Oh, sorry. Aren't trials supposed to go on for several months to years?
So let me get to that because I think some of that I'll be answering here right in the next section. So when we talk about the vaccine, what most people want to know is, like in terms of should I get it? Is it safe? How well does it work? And what are the side effects? So is it safe? If we look who is rolling up their arm to get it, okay, it's not kind of people that don't know anything about the vaccine and don't have access to information. You have everybody from Dr. Fauci to Biden to Pelosi to the Speaker of that House to Pence. You got everybody that is involved in this is getting the vaccine if they can. Okay, so that's just one thing to keep in mind. That's obviously me being very happy to get it 2 days before Christmas. And you will get a card like this, which lists the date that you get it. So with respect to that question, it's not the speed with which something is developed that really is the primary thing. The question is, did it go through the necessary phases? And this vaccine went through the exact same FDA required phases. We have a phase 1, a phase 2, a phase 3, which are very detailed, kind of planned out things. And over 90 to 100,000 individuals were studied. So it was done the same way that it is done with all the other vaccines. The difference is there were billions of dollars that were put into making this happen. So why was it able to be done so quickly? It's not because they skipped any steps. It's because they literally gave the pharmacy companies, the scientists, unlimited money to get it done. Okay. So, if I give you a car and an airplane and say, go to California, you're going to be able to get there in a few hours in the airplane. They gave them, I know people that personally work in the farm industry, on the vaccine stuff. And I mean, they were working 20 hours a day. There was nothing they couldn't buy or get that they needed. So that's really the reason. Um, the other thing is, in addition to just looking at the clinical trials, if you look at, let's look at real life, okay? In Montgomery County, there have been right now, actually, this number has doubled from when I made this up. There are over 150,000 doses of the vaccine given out, no problems, okay, at all. So it's not just in the clinical trials. In the United States, as a whole, over 5 million doses, no deaths, nothing that would raise concern that we have to stop giving it. So, I don't like to trust one thing, even me. I don't like to just trust the CDC or just trust the pharmacy, industry. What I like to do is look at everything. And whether you talk about the CDC, if you look at the drug company trials, if you look at what's happening to your neighbor in Maryland who got it, or if you look at the 5 million people in the United States, everything has pointed to the fact that it's reasonable to get. Um, the one kind of serious allergic reaction, which is real and people should know about, although it's rare, there are a small number of people, 11 in 1 million doses, where somebody can have a bad reaction. And that would be what we call an anaphylactic reaction. Probably many of you as DSPs, you probably have clients who kind of have peanut allergies or something like that. And some of you may be familiar with like an EpiPen. If somebody has a really bad allergic reaction, that's what we use. That's why they watch you. It's very rare, but if that happens, they'll basically use an EpiPen equivalent on you. And like I say, in the few people it's happened, they've all been fine. They're treated and that's it. So that's important to know. If you kind of think about the risk of like this allergic reaction, because a lot of people kind of focus on that. If we look at 1 million people, okay, and give them the vaccine, nobody is going to die from an anaphylactic or allergic reaction. If we take, 1 million DSPs who say, I'm not getting the vaccine, okay, 1,000 are going to die, not get sick, die. In Maryland, you have a 1 in 1,000 chance of dying from the COVID. And it's really important, many people see like their fellow DSP or they know somebody who got it and they were okay. And that's true many times. I see the other end. I see the 40-year-old with 2 kids, the 50-year-old, who comes in and dies a miserable death, who hasn't been able to see a loved one since he came into the hospital, who leaves 3 kids behind. I bury those people every day. So this is a vicious virus, and it's not a pretty way to die. So, really don't just think because somebody who got it and they were fine that that's the way it's going to be. It's very unpredictable. Somebody gets it and they're totally fine. Somebody else gets it and that's lights out. That's it. In terms of the safety overall, again, over 5 million doses given, no deaths, nothing that would cause anybody to want to stop using the vaccine. In terms of efficacy, which means how well does it work, 95% for both the vaccines that are out there. Somebody asked this, I think before, and excuse the typo, it should say shot number 2. Shot number 1, after 2 weeks, you're 50% protected. After 3 weeks, after 4 weeks, you're 95%. So it takes roughly about a month after your first shot to get fully protected. This is kind of, again, about the safety. It's kind of a detailed scientific thing, which I'm not going to go into, but sometimes a picture's worth 1,000 words. If you look at people with the Pfizer vaccine who did not get the vaccine, they were in the group that did not get it. This is how many of them got sick in blue. In red is how many of them got really, really sick, okay? If you look at the same number of people who got the vaccine, okay, that's it. Those people got sick, way milder. Many of them didn't need to even be in the hospital. So I think if you just look, you can see how effective it is. I mean, numbers are great, but sometimes pictures are better. The side effects, pretty much what I said before: chills, muscle aches, low-grade fever, headache, tiredness. That would be what some people get. Many people feel nothing. Um, the only, as I said, an anaphylactic reaction can happen. We're aware of that, and it's like everything else. When you go for an influenza vaccine, it's the same thing. You can get an allergic reaction. They have EpiPens there, and they watch you. It's the exact same thing. They'll usually tell you to walk around the store. Who should get the vaccine? Basically, everybody over 16 or 18. The only people that really are advised not to get it would be if you've had a severe allergic reaction to another vaccine. So I don't mean you had a side effect. I mean, you went to get the influenza shot and you broke out in hives, your face swelled up and you had to go to the hospital. That would be somebody who would probably not want to get the vaccine and speak with their healthcare provider. Everyone else in the United States should get the vaccine. Let's go through some questions and then I'll answer. So some people say it's not been tried in enough people. So again, I think I kind of went through over 5 million people, both in clinical trials, but in the real world, got it. No real problems. Okay. Zero deaths, no events. When I say zero deaths, I mean zero deaths from the vaccine. Should I wait? Why should I get the vaccine now? Because the risk of dying from COVID is real. 1 in 1,000. And particularly with the new strains, the risk of getting it is even greater. A friend said you can get very sick from the vaccine. Is that true? No, it's just basically not true. You can get a cold. You can feel a little lousy. It lasts 24, 48 hours, and then you're fine. Some people say it was rushed through and skipped steps. No, it was just done incredibly quickly. And that's because with many things, if you put enough money into it and enough resources, you can speed up the process. Okay. All that was done here was speeding up the process, not inventing something new or not skipping. They just sped up the process. Can I catch COVID? I think we said before, it's absolutely impossible. The vaccine that's being used now does not contain any live or any dead virus. It's simply teaching your body to prepare antibodies. If you have bad allergies to nuts, medicine, can you get the vaccine? Absolutely. CDC and all the medical societies recommend that you get it. Only if you've had a really bad reaction to another vaccine would you not get it. To make it hard for you to get pregnant? No, that's just a myth that was put in the media or published and then kind of people ran with it. 95% for the current vaccine. It will protect 95% of the people that get it. This is a common question. If I have HIV, cancer, or a weakened immune system, some people have Crohn's disease, some people have immunological diseases, HIV, cancer, heart disease. Absolutely. You need to get it. It's even more important because you're at greater risk. So all the recommendations are that these groups should get it. If you have a kidney transplant, absolutely. And again, the CDC says, yes, you should get the vaccine if you've had it before, since we don't know how long the protection lasts. Some people ask if I'm on what we call immunosuppressive drugs, chemotherapy drugs, or things like that, certain special drugs, can you get the vaccine? You have to check with your provider, but generally, yes. So the answer to who should get it is pretty much yes. All right, let me open it up now for questions for anybody that has any residual questions. I'm happy to answer anything.
5 minutes, so I don't assume that we are going to get to everything. So a
If
quick.
we could unmute the mics if people want to ask a couple more, and then yeah, go ahead.
So it's up to you then, Dr. Greenberg. Do you just want to unmute and then I can take down the questions and we can answer them offline and send them out?
Yeah, why don't we do that? Why don't you unmute the mic and then we'll go. We won't go much over, but I'll try to get through a few. Yeah.
So all the questions in the chat, everybody, we are going to answer those offline and then send out answers. If you have any questions right now, just go ahead and ask Dr. Greenberg. You can unmute yourself and ask.
I just wanted to say I got the vaccine 2 days ago, and it was just a slight pinch, and I've had no side effects whatsoever. So it's worked good for me.
Thank you very much. And that's huge. And I do ask everybody on this call, the best thing you can do is if you've gotten the vaccine, tell 3 other DSPs what you felt. And if you haven't gotten the vaccine, ask somebody who did what they felt, because that goes a long way to helping answer a lot of concerns. Thank you for that. Anyone else?
I have a question.
Yes.
You said the immunity covers, like, you're not sure how long, but like 3 months, at least, maybe at
Mhm.
least 3 months. Does it mean after the 3 months, it's possible if you get the COVID, you can really fall sick?
Does that mean that after 3 months, it's possible to do what?
When you get the COVID, you can fall sick, like if you have not gotten it at all.
Sure. So we just don't know how long it'll protect you for. So I don't want to tell you something that we don't know, but we think it will probably protect you for a good amount of time, and you'll be way safer than somebody who hasn't gotten it. We just don't know how long that will be.
Okay.
And if enough people get the vaccine, if everybody got the vaccine, like the virus would have no place to live. So you'd be safer anyway, because you wouldn't have someone else that you could even catch it from.
Okay. Thank you.
You're welcome. Other question?
Yes, I have a question, please.
Yes.
Does it mean that this COVID is not going anytime soon?
I think that, yes, I think that the virus is going to be here for, in some form or another, this is something that's going to be here for a couple of years at least. Yes. So the only way to make it safe, like the flu doesn't go away, it comes back. We don't know that the virus is going to come back that way, but and the way to be safe is going to be by everybody getting vaccinated so that you can't get infected. The virus is not just going to mysteriously go away, in 6 months.
Thank you.
No problem. Other questions?
I have a question. How is the doses of the coronavirus determined for a person?
How is the dosing?
The dose, yes, the dosage.
So, that's a very technical question that I wouldn't be able to give you an exact answer to. Usually that's done like a year and a half ago in the labs when they first check. What they do in the very beginning is they test different doses in small amounts of people, and they can tell how much is needed to make your body safe. So that is all way back at the beginning before they even do the larger things. So they basically test and they measure how strongly your body's protected, and then they come up with the dose.
I have a question.
Yes.
When I was looking at the trial, the numbers that were used for the trials, I saw that the Caucasian has about 83%, and the Black has about 9%, and Asians have about 4% in the trial. Why was it like that? Is it that the Black does not want, the Black did not want to participate, or what? Why is it like that? Why is
Sure. So there's much more, the same thing. I don't know if you remember in one of the beginning slides where I said how many people didn't want to get the vaccine. There's much more concern and not willingness to get the vaccine among minority groups, whether it's Latino, Asian, African Americans, Black, brown, whatever. There's much more unwillingness. So it's the same thing with the clinical trials. When they do the trials, it's harder to get that many more than that. So that's a big part of the reason. What's helpful though is, and I don't have the exact numbers, but we don't just have that. We've got 5 million people in the United States who have gotten it. And of those people, even though it's a smaller amount, we have many, many Blacks, Latinos, Asians, brown skin, so Chinese, all different mixes. So in the real world, people have gotten it. So, but the answer to your question is it was harder. More people said no. If they were Black, they said no. If they were Latino, they said no.
So for the people who have taken it for the other races that have taken it, from this observation that, because I believe that we are still observing the vaccine.
Mhm.
So from this observation, how have the Black and the other races react to this? Is there any?
Sure.
Yeah.
No, that's a really, really good question. And I didn't go into the details because that's kind of, but if you look at, you know, how effective it is, there's so far, there's been no difference in effectiveness based upon, you know, for lack of a better word, I'll say race, but skin color, whatever you, okay, there's no difference, has been no difference. That doesn't mean we won't find there are small differences. Usually the more we study, we may find, we probably will find that, for example, the older you are, it may not be 95%. In that group, it may be 80%. So there probably will be some differences depending upon all different groups, but no differences that we know of at this point between different groups of the population in terms of effectiveness, and absolutely no difference in terms of safety. So I think that that's reassuring to the point, but we'll need to follow it further.
And I have another question. When I was studying the COVID something, we know that this is not the first time we have had COVID. Why is this particular COVID different from the ones that we have had before?
When you say the ones we've had before,
Yeah, outbreak of COVID, because we understand that this COVID has been here all this while for some time. I mean, different types of mutations.
No, yeah, it's a little bit complicated. There's a scientific kind of, COVID is a general term, coronavirus. If you look on a Lysol can, there are many different types of COVID, but what we are talking about, if you want to be technical, is SARS-CoV-2. So this is a particular virus. COVID is a more general family that we use the word, but this is a particular virus. So this particular virus is brand new. It's a mutation that was never here. The broader family has been here, but not this virus.
I have a question, Michael,
Yeah.
Dr. Michael G. Why is it so many different vaccines? Why do you have to have more than one and it's just not one vaccine?
Sure. So part of the reason, a big part of the reason is when you develop a vaccine, it frequently takes 5 or 10 years. We had no idea, you know, a year ago whether the vaccine that Pfizer was going to develop would work, or so really what the government did, and smartly so, they took billions of dollars and gave everybody, every major pharmacy company, the ability to develop the vaccine. Because let's say we had put all our eggs in one basket and then the Pfizer vaccine didn't work. So by diversifying, we were able to get, because there are many other vaccines that people try to develop that didn't work. But by starting with 25 or 50, we were able to quickly get the ones that did work. So that's the reason. And it'll probably in the long term be a good thing, because we will probably find, you know, a year from now or 2 years that certain of the vaccines will work a little better in older people, certain work better in women. So by having more that work, it's a good thing.
I'm sorry. Okay, so you have to go through all these phases just to find out which one works. So how do you know that it's going to work for sure with the COVID and the coronavirus?
Because you only get when you get to the third phase, that's when you have to do a large trial like the one I showed you, the Pfizer or the Moderna. Many of the other kind of small ones, it didn't work. So when you get to the third phase, you have to go out and enroll tens of thousands of patients. And that's the point where Pfizer and Moderna were, you know, they were able to do that. Those work. The AstraZeneca works at phase 3. So there's a lot of other stuff that doesn't get to that level. You're only seeing the ones that made it through all the other phases where it worked.
So one more question. So is it similar, because, you know, like when you get the flu vaccine, however, it seems as though even with the antibiotics, it gives you the flu. Like sometimes if you get it, some people, because it reacts different in everybody. And some people, if they get the flu vaccine, they will get sick and be sicker than what they really was. So is that the same side effects that happened with the Medina and the other one that you were speaking of? Or how
So,
does that
sure.
affect?
So you will not get sick with COVID. You will have side effects, some people, of like fever, chills, and headache. Some people will have that, but that's not because you're sick with COVID. That's because you have a healthy immune system and your body's building up antibodies. So that's, yeah, you're not sick with COVID. You're just, your body is, building up antibodies, and that's what it shows. Does that answer you?
A little.
No, go ahead.
A little, but let me ask you this. So, what is the difference between coronavirus and COVID-19?
Sure. So when we talk about COVID-19, we are really talking about the infection. Okay, we are talking about the disease. Coronavirus. The word coronavirus is we use that in common language, but coronavirus, it's like a family. Like my name is Greenberg, so I've got a wife, 2 kids. If I say the Greenberg family, that's different than saying my son Robert. So the coronavirus is a family. The actual virus is called SARS-CoV-2. Okay. When we talk about COVID, we're talking about generally the infection.
Okay.
So you can walk around with SARS-CoV-2 virus in your nose, but not have COVID because you don't have the infection. Does that answer?
Yes, that does. Because a lot of people that I speak with, they think it's all the same. So I'm glad you explained the difference.
Yeah, no, it's very different. Yeah.
Thank you. I appreciate it.
No problem.
Thanks for
So
sharing.
Dr. Greenberg, I'm gonna give it one more question for someone to ask, because I want to be respectful of your time and everybody else's time, and I only signed this meeting until 11. So whoever would like to step up and ask one more question, and then we are going to save the chat, and Jessica, Dr. Greenberg, and I will work out the details and get the recording and all the FAQs from the chat out to everyone.
Okay, I have a question. Does any prescription medication intervene with the vaccine?
I would have to, I want to qualify by saying if you're on particular medications, check with your healthcare provider, because I can't be, but in a simple sense, no, there are no real interactions with those, medication, with all common medications. And I know there are probably a lot of other questions. Can everybody see my screen?
Yeah.
I put up an email address. I'm probably going to try to set up a separate kind of just Zoom group, totally outside of anything having to do with anybody's work or anything else. But for parents, people, individuals that have questions that want to talk about it, I mean, this would be obviously on your own time or however, but for anyone who's interested, if you want to, email me just your name and email address, I'll let you know when that comes out so that there'll be a way for people to just kind of continue the dialogue. Again, this has nothing to do with your work, your organizations. This is simply something that I'll put out there for people that want it. And I will try to answer every question that that you guys get me from the chat box. Thank you.
Thank you so much for Dr. Greenberg. On behalf of all of our 4 companies and all of our affiliates, we appreciate the time that you took today
Absolutely.
to
If there's
educate us.
Anything I can do in the future, please, any of the affiliate, just reach out and I'll be happy to do whatever I can do.